All right. Hi, Jonathan. Ahead of
Hello,
our
Maria.
exciting podcast today, I have a question for you. We've been talking so much about industry consolidation and the good that corporate organized dentistry has brought in. Does that mean the end of entrepreneurial dentistry? What do you think about that as an entrepreneur dentist who has that startup entrepreneur bug?
Well, I have to tell you, 3 decades later of starting companies and having the spirit of an entrepreneur within the oral health world, absolutely not. In fact, my deep feeling is we are on the tip of the iceberg of entrepreneurship in dentistry. And in fact, Dr. Jason Auerbach is going to tell us what he thinks also.
Another entrepreneurial dentist, oral surgeon. Let's see what he has to say about this.
Yeah,
Stay
he's
tuned.
amazing.
Let's get into it.
All right.
Hi, everyone, and welcome to another episode of the Think Oral Health podcast, where myself, Maria Filipova, and my partner in crime, Dr. Jonathan Levine, invite trailblazers, innovators who are connecting the dots between medical, dental, and overall health. So today we are pleased to welcome another trailblazer innovator, an oral health physician, oral surgeon, Dr. Jason Auerbach. So Jason, welcome to the podcast. We're very happy to have you. And Jonathan, hi, long time no see.
Look, nice to see you, Maria. And it's great, Jason, to have you here. Just a little bit of an intro for somebody who's absolutely trailblazing in organizing our fragmented dental industry. And he's doing it really on the specialty level. It's very exciting. He is the founder of Riverside Oral Surgery. It's the predecessor to the current company, Max Surgical Specialty Management. His vision was to create really the optimal patient experience. And what he's done now by partnering with great capital partners and operators, he's been able to go out to 22 locations and taking what he learned when it was just a couple of offices and playing that forward with systems and protocols that are focused on a high level of specialty care. That is near and dear to my heart. I think I've equally looked to create my whole world of dentistry along those lines. I'm so excited, Jason, to have you here and to share your learnings and your wisdom to our listening audience.
Thank you so much. Thank you both for having me. Just for a little bit of insight for the audience, I met you guys both not too long ago on a very special mission that I hope I can take part in many times going forward. So it's nice to see you here, and I look forward to this very much. Thank you for having me.
Origin story. Yeah, maybe that's where we start, the origin story, where it all started, how the three of us met for the first time. So tell us about this magical place in Eleuthera, the Bahamas, and this magical trip that all of us found ourselves on, thanks to Dr. Jonathan Levine and the Glow Good Foundation.
Yeah, so for years I've been hearing about this trip in Eleuthera that you guys do, and for years I was hopeful that I might get the look. We have a mutual friend in Jason Deblinger. He was the primary guy who introduced me to the concept, and as such, to really be involved and to be able to provide care for people who are so desperately in need, where access to care is really not what it needs to be able to do that at an extremely high level was something that I was very, very happy to be a part of. There are so many different types of mission trips, and there are so many people and patients across the world who are in need of care. But I think what separates this one is the focus on, comprehensive oral health care, education, trying to create an environment in Eleuthera in particular, but kind of more widespread, that will hopefully yield a less of a need for us in the future, is really what kind of separates, rather than like there are a subset of problems, we go treat the problems, we exit the island, and then kind of whatever happens. You guys have real roots there, and you're doing things specifically there. And then I know that plans for beyond there that I think are going to change the way that oral health care is seen, hopefully across the world. So it was really a pleasure to meet you both in person, and now to be doing this with you and hopefully sharing many memories going forward.
For our listeners who've heard about this mission before, Jonathan, hit the highlights of just the numbers. What happens? How many patients do we see? Nurses, hygienists, oral physicians like Dr. Auerbach, German, very German. I should not be tripping up over your German last name, but never mind. So, Jonathan, give us the highlights of what happens and why is this such a special place?
Well, we started on Lenny Kravitz's lawn chairs and portable aseptical units about 9 years ago. We've evolved to a 14-chair freestanding clinic. Thank you, Henry Schein. Thank you, Banco. Fantastic business partners, 3Shape, Sprint Break. Today, with these companies, we 3D print dentures. We have amazing specialists from all over, truly the world. It was a pleasure to have Jason, Auerbach, his expertise, his knowledge to add to our team. We bring down about 100 professionals and support staff. And we have technicians, hygienists, endodontists, like Jason Deblinger, our mutual friend, prosthodontists, restorative dentists, and really nurse practitioners. We have a very integrated healthcare model. And what the hope is that we can take these learnings from taking care of the people who have such a lack of access to care, but with technology and expertise to really build out a very unique business model to level the playing field of equality and also to help what we do back at home. We also launched a leadership program where we worked with our professionals and brought in great leadership coaches. You being a change agent, Filipova, you were part of that, and that was really exciting. But that's enough about the Global Foundation, because I could talk about it the whole time. I want to talk about it, Jason. Jason's journey. Good. Let me just start it off.
Please, yeah.
Jason, you are an innovator. It's all about understanding compromises that exist. What did you see early on in your career that put you on a path of innovation, of changing the way that you think about the delivery care for your specialty of oral and maxillofacial surgery?
Yeah, so I grew up on Long Island and ended up in Manhattan for a bunch of years. And then I came out to northern New Jersey. And this was in the early 2000s. And still, despite there being a very sophisticated level of patient here right outside New York City, the level of healthcare that was being delivered was very clinical. It was very kind of closed off. It's kind of this, the older administrative assistants just sitting at the front desk with some like sliding glass window, almost angry that you were bothering her from doing whatever she was doing behind the desk. And I really felt that there was a clear need for the hospitality-based approach to healthcare. I was fortunate to exist in a world where I was benefiting from really great experiences, boutique hotels, high-level restaurants, spas, things of that nature. And they seem to really get it, to understand that patient experience, not patient, but their customer experience. And I really wanted to take what I learned there and apply it to healthcare, assuming also that the great healthcare outcomes were associated with that, providing the best care, best materials, and all of those kinds of things. And so I really coined this concept of optimal patient experience each and every time. I believe that every single decision that we make from an operations, even a finance perspective, has that baked into whether or not it optimizes the patient experience, because patients come to see oral healthcare providers in general, I mean, all healthcare providers, but oral healthcare providers in general, with a tremendous amount of trepidation, anxiety, downright fear. Many patients have had negative experiences. The mouth is a pretty accessible and intimate portion of the human body, and so it makes patients feel very, very vulnerable. So again, to create that optimal experience from the first phone call down the line was at the cornerstone of what I wanted to do when I started Riverside Oral Surgery in 2007. So
amazing.
Thank you.
And those learnings, when you take those learnings and you play it forward, what did you do? And how long did it take you once you started your private practice and saw the compromises and said we needed more of this hospitality approach to what we do? We have to kind of flip the script on what a patient experience and a journey is all about. How long did it take you to say, okay, let's create something that's scalable. Let's go build something out. What a kind of more of, I guess, Filipova, you like to call the entrepreneurial journey, right? So
that's right.
How long did that take?
So for the first few years, at inception, it was really all about building the building blocks of what would ultimately become this kind of practice. So for the first few years, I was alone. I was alone in the sense that I was practicing alone. I was trying to build the processes involved in that one private practice concept, and I really honed them because and this is not just kind of like, throwing words out there. The people who were working with me were as invested and still are invested in this concept of providing optimal care as I was. And so, I don't know, that'd be top down, whatever it is. I was very fortunate to find a team of people who were all ethically driven, complementary skill sets, but basically the same goals and desires, which was to treat these patients really well. Um, and we were building out those processes. Then I found the opportunity to actually expand this first physical plant, which is where I'm sitting now. And then I had this thesis where I could find providers who were providing excellent care on the periphery of my zone of influence. So they had very good reputations, but maybe they weren't putting any money into marketing, or they weren't upgrading their offices, investing in technology, expanding the scope of the services that were provided. And we would find a younger surgeon, we'd make the handoff, we'd renovate the office, we'd invest in marketing, and we would expand the scope. And we did that over and over again in offices that surrounded my primary office. And then there came a time where we wanted to kind of prove out this concept. Was it just my reputation that it was based on, or the reputation of the brand, which was very important to me? Or was it something that we were doing systematically that could yield success? So we found an office. There was a gentleman who unfortunately became unwell and needed to figure out a legacy plan for him. So we went down there. We didn't have any reputation down there. We implemented the same system that we had up here in these offices, and it proved itself out to be really a successful opportunity for us, which gave us the confidence that we could do it at distance and then we could do it at scale. And over the course of a few years, we grew to, I think, 10 or 11 offices all over the New Jersey. We hired a COO. We hired a true revenue cycle management team, which for people who may not know, it's like things like billing and insurance. Many people don't even know what RCM is, even relatively sophisticated dentists, healthcare providers. And I invested in infrastructure and built out an administrative team that was exceptional, that complemented me. I have very strong business development, marketing, branding, relationship management, this kind of thing. I can get the business. I also have this kind of intuition in terms of the patient experience and like that creative side. That's how I come at everything. But I am not a finance guy. I am not an accountant. I mean, EBITDA, this concept that people talk about all the time, basically profitability of a business, was something that was so foreign. I never really concerned myself about that. I wanted to invest more and more and more into the practices so that I could provide the level of care. I say this, and this might sound a little hokey, but I think like attention to detail in everything that you do implies attention to detail in anything that you do. Patients feel it when they come into the office, that if I care a little bit about something that might seem like a small detail to somebody else, that clearly I'm going to care enough about the service I'm providing. It's not something that they can even it's intangible, but it's there. And I think that has served me very, very well.
Great. I mean, you could write the playbook on how do you start a small business and grow it into a repeatable, scalable playbook. And, starting with doing right by the patient is time and again proven to be the right business strategy. You talk a lot about the optimal patient journey. Could you just walk us through what optimal patient journey looks like for a patient in your office, especially through the lens of that overall oral systemic health, right? By the time patients come to your office, I mean, these are invasive procedures, right? Yes. You're doing oral surgery. It doesn't get any less bloodier. It doesn't get bloodier than what you do, right? So it's not minimally invasive procedure. It's not a pleasant experience by itself. So tell us how you make this invasive procedure delightful, dare I say, and how do you connect your work as oral surgeons to the overall health of the patient?
That's a great question. I think I feel also multiple parts, right? I think it starts with educating our referral base, educating the population at large, and educating our healthcare partners. So as oral maxillofacial surgeons, we kind of we're in this hybrid role, right? We are dentists, we are dental professionals, we're dental specialists, but we are physician surgeons of the mouth, of the head and neck, really. Anterior of the ears, over the clavicles. That's our department. We understand the anatomy, the physiology, and all of it probably better than most other healthcare provider. So it's incumbent upon us as an organization to educate the public, to educate our referring dentists, and to educate our healthcare providers as to what services we provide and what we do and how what we do relates to what they do and how it helps. The first thing is getting the referring dentist comfortable with understanding our scope of work, so that they understand that when they have someone in their office that has X, Y, or Z, that we are the people that they can feel comfortable sending their patient to. Once we have that relationship established and they know that they can repeatedly depend on us in any way, then it's really a matter of being an open source of information and communication. Patient picks up the phone, patient goes to their dentist, the patient is in need of some sort of oral surgical care. They know that they can then look at resources within the community, and we are going to be there as a leader, as a de facto expert in that field, and be able to kind of walk them through. Patient picks up the phone, they're being greeted by the patient care coordinator or somebody in a central location who's actually getting all their information, but talking to them as a human, not just kind of filling out forms and like, okay, I need your name, what's your insurance, this kind of stuff. That's secondary. It's basically forming a very early relationship with that patient who's in need of care, so that they feel trust. And then it's really getting them into the office, having them meet whichever surgeon they're going to be seeing, identifying the right surgeon for them based on their priorities, and then having them see the right surgeon, develop more of a trust. Then we have a direct conversation with the referring dentist, so that the dentist feels that they are, in fact, a partner in the decision-making process for this patient's care. Many times, in fact, probably one of the biggest knock on oral surgeons is like, we think we know everything, we're difficult to deal with, we're a little bit kind of cocky, for a lack of a better word. And as such, like, it's a turnoff.
You're sounding very self-aware to me. I don't know where that's coming from.
Maybe. I don't know. It
sounding very self-aware. Mature assessment, right?
No, but I mean, I think really the fact is our communication, constant communication with the referring dentist, and then based on the patient's overall medical condition, which is thoroughly assessed here, head and neck exam, basically a true history and physical. Comprehensive, but more or less a true history and physical. When a patient is in this office, they know they're being treated in the right place because we're paying attention to all of the things that could affect or could be affected by their oral health. So, we speak to their endocrinologist or their cardiologist or the rheumatologist or whatever we need to do, pediatrician, whatever, and we coordinate care based on what's right for that specific patient. Very, very kind of bespoke, if you will, approach to care. And we're very focused, all of us, on the kind of the oral systemic health connection. But there's also kind of, and I didn't coin this term, this is another oral surgeon elsewhere. He was talking about the mouth-mind connection. A lot of people think about how important the oral systemic connection is clear. The data proves it. It does take a little bit of convincing for the world to understand it, and even some of our medical colleagues, but it's clear. There's no question, inflammatory, and there's a ton of it. But mental health is such a big part of what we are all aware of in the world now, and a healthy oral cavity yields so much better mental health. I mean, just the ability to comfortably smile gives you the confidence to change your life. That's not rhetoric. That is real. Yeah. I mean, Dr. Levine plays much more of a role in that, in the sense that patients come in and aesthetically and functionally are compromised, right? And as such, they leave his office in a much better position that is forward facing. So like what he's doing is yielding that directly. We're basically building the foundation on which Dr. Levine can do what he's doing. Yeah, I mean, all of that, and then 1,000 more tangents I can go on as to how we did that.
I want to pick up two things from what you said, and Jonathan, I know you want to get in here as well.
Please go.
The two things that's kind of stuck out to me was, one is how much of the patient experience is dependent on a brilliant team and how much of that experience is high touch, right? I want to follow up with you. You started with, you have an amazing administrative team behind you. They probably know back and forth all the billing and the admin and the ops. There's a place for automation in patient care, and that the first place is revenue cycle, back office operations. The patient-facing touch points are much harder to automate, and that's where you really want to pay attention to detail. That's something that it was very clear from the journey you were describing. And the second piece is that care coordination that you kind of so almost effortlessly brushed up on, like, yeah, we coordinate with the pediatrician and the primary care doctor and the specialist. That takes a lot of effort. You called it bespoke. But the reason, my hypothesis is, the reason we don't see more of that oral systemic health connection or mind-mouth connection operationalized is precisely because of the lack of that care coordination.
Yes.
It's so damn difficult. That's a technical term. It is a whole level of difficulty and it's very high touch, right? It's a doctor to doctor picking up the phone and saying, let me talk to you about this case. So in your experience, and you've been doing this for a while, what has worked that you could consistently care coordinate effectively for your patients and advocate effectively? Because this is you've scaled it, so you must be doing something right at a large scale.
I don't want to like minimize it. It's just people who care, right? And I think we're very fortunate in our business, in my specific business in Riverside Oral Surgery and the other Max practices, that we have exceptional patient care coordinators who are responsible. Everyone has a very clearly outlined role in terms of information gathering and all of that. And then you have to have elevated people that you trust. I have so I have patient care coordinators at the front who are exceptional, and I have a treatment coordinator who in some oral surgery or specialty practice might be called an implant coordinator or something like that, but she coordinates everything for everything. So if I'm doing a consultation and she's standing in the room and this gentleman or woman is talking about he's on Plavix and aspirin, or he's on some other blood thinner, or he's got a history of taking bisphosphonates, which might yield the higher risk for osteonecrosis. And we need to have a discussion with another practitioner as to maybe we need to take a drug holiday off the Prolia or whatever. I'm throwing terms out that no 4-year-old would know, so I'm failing here. But
dependencies, right? Remember our rule? Like you have to talk to the 4-year-old. We're breaking our own rule.
Okay, I'll say. So there's a class of medication that exists called bisphosphonates, which is a medication that is used in patients who are osteoporotic or osteopenic, meaning their bone density is lesser quality.
Yeah.
And when they take these medications, it affects the way that the bone remodeling process occurs. And because of that, and because we as oral surgeons are dependent on normal bone remodeling for proper healing, sometimes if we would remove a tooth, we need the bone to fill back in so that the soft tissue can heal. That doesn't happen naturally as well because of these medications. They develop something called osteonecrosis, which means bone death, because of the fact that the bone is now not covered by soft tissue, not getting its vitality as well, and actually is now exposed to the oral cavity, creates a whole slew of problems. So
adverse outcome. And it's not an adverse dental outcome, it's an adverse clinical outcome. It leads to all kinds of complications.
That's right. Yeah. So we understand that. We know that it's more than just CYA and getting consent and telling patients. If we can try to create some sort of even maybe out of the box thinking or atypical way of treating something in order to remove this risk or to lessen this risk in an appreciable way, we do that. And the only way to really do that is to converse with the other practitioners who are playing a role in this. I can say to a patient, hey, just go off your Fosamax, you've been on it, whatever it is, I'm sure your bone density is fine, or stop taking your blood thinner because I need you to not bleed after I do this. But I don't know the level of severity. I don't know if this patient necessarily is just on a blood thinner because they have this kind of, they've had AFib once or twice, arrhythmia once or twice, or if they've had a history of DVTs that is proven and tried and true, and they're a high-risk patient, or they could stroke out or whatever. They could have a stroke. So basically, the point of the matter is you need to assess every single situation. So you have good people who could do the basic level of information. You have someone who's kind of like a mid-level care person. This exists in a healthcare way, but not necessarily in dentistry so much. I have someone who's very, very well versed in it, who can have conversations and is comfortable having conversations with doctors and nurses and things like that. So I have a team, but I'm fortunate to have a team. Not everyone has the time or the team members. So it's really a bandwidth concept as well. You can't provide this high level of care unless you dedicate people to it. But it's hard to dedicate people to it when you're early in your career or you don't have a really profitable practice where you can actually, use that revenue to pay to someone who can actually do that for you. So I realize it and I appreciate it, but I was committed to it very, very early on because I felt like the success comes, the money comes for sure if you do the right thing. And I wasn't so worried about the investment I was making in building the team. I wanted to create this optimal situation, which has reaped the rewards. It's been kind of like a self-fulfilling prophecy, if you will.
Bam, 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 bam. We like to say life is a team sport and so is dentistry, Jay.
True that.
I'm right there with you. So here's the question. So you were talking a lot about the team early on, bringing the people together. And you had a vision, which is to create this amazing patient experience. You bring in words like trust. You bring in words like the care of the patient. It's kind of the basic blocking and tackling of success of what we do. And really, you can just about say in any craft. So I don't want to underestimate something because your ability to be this successful entrepreneur, you have a certain sense of who to hire, how to hire, and how to create a magnet in an organization that these talented people, they want to stay with you and they want to grow with you, and they're able to also attract like-minded people like themselves. So in your journey, I guess my question is, because, I'm thinking about the future of healthcare. I'm thinking about the things that you've learned. How would you instruct someone who has a similar vision that you had, maybe turn back the clock 16, 18 years ago? And what would you tell them? What are the important concepts of understanding the people side of the equation, attracting the right people, knowing who to hire, and the kind of culture that you've been able to build in your organization?
It's hard to put it into words. I have certain beliefs on that. So we have, as part of our values of the business and part of the values of this concept of always do the right thing, right? It's literally written in, always do the right thing every single time. To me, I was always very black and white in terms of how I saw things. Like, is this the right thing to do or is this the wrong thing to do? And then you build a team of people around you who have the guts to remind you when maybe you're not always lined up with your initial thought on things, right? So you have to be able to build a team of people who are empowered to advise you when you're a little askew, because if you don't, you can go far askew and you could end up in kind of the wrong place. So I said it before, the blocking and tackling piece, the actual skills involved, you have to be able to look inward, understand what you do well, which requires a certain level of EQ. And you have to understand with the humility that there are people who do things better. A lot of people say this in business, like you want to find people who are smarter than you and whatever. I don't know that it's smarter. I feel like it's different aptitudes. I think everybody brings a different skill set. And again, as long as you can define where you want to go together as a group and everyone is aligned in that way, you will do further, much, much more with a good group of people with totally diverse skill sets, diverse perspectives. My first partner, the first person who ever bought into my business, who's my partner now, Sung Hee Cho. I'm a single degree. So oral maxillofacial surgery, you can either go into, you right after dental school, you either do a 4-year residency and you maintain your single degree, DDS or DMD, or you do a 6-year dual degree program where you get your MD, you go to medical school for a couple of years, and not that you have different levels of skills necessarily, but your opportunities may be a little bit different or whatever. So he is a dual degree. He also did a fellowship in American Head and Neck Society fellowship in the ENT department at Emory, where he was doing microvascular surgery. So I'm bringing this dental alveolar skill set. He's bringing this kind of expanded scope oral maxillofacial skill set. He brings much more of a systematic approach to things. I'm much more of this kind of typical entrepreneur, abstract, creative, a little bit ADD, more than a little bit. And so together we would ham and egg basically everything. I'm going back 15 years ago. We would figure things out. And when it came to recruiting younger surgeons, if you liked my entrepreneurial vibe, maybe you related to me, you were sold on that. If you liked his much more appropriate, not that, you know what I mean, much more
clinically focused, detailed.
Right, exactly.
Right.
You kind of were with him and you're in his camp, but we're all in the same team together. And as such, it worked and it continues to work. Yeah. We've been very fortunate by
it goes back to the superpowers. Bring those superpowers to the table. And
we can't relate to that at all, Jonathan, right?
No,
two different people with different aptitudes coming together that can't relate to that at all.
But such an important word is we like to say hungry and humble, right? You got the ambition, but you got the humility to understand what your strengths are. And Jason said it multiple times that he knows what his strengths are, and he was able to hire the other areas that he knew he didn't want to go near, which is so important, especially early on in a career where there's a lot of learnings as you're figuring out systems and protocols to scale.
For sure.
Build out, right, Maria?
I also love the do the right thing mantra, because, you have the do no harm and you also have do no evil, right? If you look at software and parallels. And so starting with the positive outcome, do the right thing. Always. Because doing no evil is a pretty low bar. And so if you're really aspiring to do the right thing, that's where you're getting on the call and you're chasing people and you're taking that extra mile, even though it might not be in your SOP or whatever was prescribed yesterday. And that's really, hopefully our listeners are taking away from this, that you have to start with the right foundation, and then like attracts like, right? Obviously your team is seeing you in action, you're modeling those behaviors, and they're mirroring your behavior and your partner's behavior. I mean, love it. Any advice? And I know we are wrapping up, but this feels like you need to probably come back to our podcast and maybe bring in your partner with you. But what is the advice that you would give to young aspiring dentists who are just graduating from dental school, who are kind of looking at this changing landscape and thinking, wow, starting my own practice is daunting, the whole new world of DSOs and we have this industry consolidation, or should I just do, something like join an FQHC and see how I could make an impact there? Very different paths for graduating dentists, even if they're not, a single degree or dual degree graduate like you and your partner were.
Yeah. So I think it's an interesting time, and I don't want this to be almost like a self-serving advertisement, but this platform that we started, Max, and it might come off this way, but please just give me a little bit of latitude.
If it's all warranted, we're all open to self-serving advertising. Yes, go for it.
Fair. In the most recent couple of years, there is a lot more interest in specialty dentistry, private equity backed, DSO expansion into specialty dentistry, multi-specialty DSOs and things like that. And I found that we had a very strong brand in the state of New Jersey. So anyone who wanted to enter the state of New Jersey in the oral surgery space was talking to us. And we had a ton of opportunity with large-scale general dental DSOs, with multi-specialty DSOs, and then a ton of direct investment private equity, and then even the national strategic oral maxillofacial surgery platforms. And what was clear to us and became evident was there is so much information out there that is available to us. You just got to know the right places to find it, because ultimately, and again, this kind of goes into how I think about things, it's really the people behind the organization, because organizations have their own group. I mean, people have this negative feeling on DSOs or corporate dentistry or whatever it is. It doesn't necessarily need to be negative. yes, in many ways, trying to squeeze EBITDA out of an existing practice is a negative thing. If there's any oversight of the clinical delivery of care by the DSO, that is a negative thing. I mean, there's many different things. So we set out to build an environment, a platform in Max that was completely, as it relates to any clinical decision making, any clinical delivery of care, 100% surgeon led, and all things are surgeon focused. So that was something that was very, very important to us. If you're a young oral maxillofacial surgeon coming out, you have to look at what your opportunities are. You can make a ton of money working in an itinerant way for one DSO or multiple dental practices where they bring the oral surgeon in. But that is, for me anyway, it was not, and I did it when I was young. I worked in 9 different offices as I started building Riverside Oral Surgery. It is not a long-term lifestyle choice that is best when you really want to plant roots and deliver the best quality of care, where you have consistency of care and comprehensive care, follow up with your patients, management of emergencies. And this type of life is really not the ideal. But yeah, I guess really what it all boils down to, and really where I'm going, is it really has to do with the model of the practice that you're joining and the personalities and the people that are within that organization already. And like I said, there's a ton of information out there. Fortunately, now it's been going on for a while. Speak to people, look at the track records of the organizations that you're joining. You know, again, in my history of this entire thing, I've only had one associate ever leave me. He left me in the middle of COVID, and he left me to go to San Diego, which was something I can never compete with. And so what I say, and I would say even call him, meaning speak to people who have been in the organization, who are in the organization, because ultimately those are the people who can speak to really what the environment in and the culture in that organization is like. So I will also end with, I will speak to this, end with this kind of, I don't think the day of entrepreneurial dentistry is over. I believe wholeheartedly you can be an entrepreneurial dentist and separate yourself. I would know how to sell against large scale organizations. At the same time, I don't think that dentistry or healthcare at scale necessarily means worse care. I think it probably means better care if it's done right, because you have shared ideas and best practices that you can learn from each other. And you also have tremendous resources financially and all of that. So I think both ways of going, or any way you go, you can build a really wonderful foundation and a tremendous life. We're very fortunate. I think oral maxillofacial surgery in particular is the best specialty in all of healthcare, but I think oral healthcare, and now the connection between oral and systemic health being as established as it is, we're only going to see continued evolution of kind of where we are and where we're going. So I think it's really a good time. Some people might not see it as kind of the golden age, but I think it's really like the next place, and we're going to see some tremendous opportunities come up going forward. That's what I think.
I'm right there with you. I'm right there with you. I couldn't agree more with you. I really do think I am one of those optimists that believe we're in this golden age, and for the organizations like Jason's that's building this environment to attract these talented people who are also entrepreneurial. It's taking the big organizations, but creating a culture of entrepreneurialism, and really to take the learnings from the wisdom of doing this over time to scale and to bring in the right people. Jason talked about vision, purpose, values, like setting up that vision and creating alignment is so important, as we know organizationally, and just great pearls for the industry. Maria, wouldn't you say? Jason, thank you.
I love it. I mean, thank you. We love it when we have 2 entrepreneurs who are dentists who are coming to the show, and it's we couldn't have said it. We couldn't have ended on a better note. I just want to make sure that our listeners know that they could start anywhere, and you learn from your not best choices as much as you learn from the best experiences. Sometimes you need to see how not to do things that inform your own style, process, and practice of dentistry. So embrace that. Thank you, Jason, for joining us and sharing your learnings, and we'll see you next time.
Yeah, it was great. Thank you. I'd love to come back anytime.
Thank you so much. Great to have you. Thank you, Maria Filipova.